So think about the prescribing triangle before you prescribe. Think of all the elements from the prescribing triangle in terms of assessment, getting it right first before you ever put pen to paper or generate an electronic prescription. Think about fraud. Think about your professional responsibilities. Look at your professional body. What do they say about prescribing? Some of the Health Professions Council refer to the general codes of conduct for you, but you need to translate these into prescribing practice, and it's perfectly doable to do that. The NMC do have NMC standards for prescribing 2006, but you need to be clear about how your professional body view this practice of prescribing, this extended role. Think about security of prescriptions. Don't hold lots and lots of pads with you, which increases the risk of them being stolen and your target for theft. Have them locked, some in a safe, some that you're going to use. You may find that serial numbers are taken for prescriptions when they're first given to you and recorded. Certain areas, it's good practice that they may put the prescription number in the patient record, so it's clear which prescription was used right up to a point, and if a prescription pad goes missing, they know exactly what numbers thereafter to look out for as being stolen ones. If your pad is stolen, as I said, manager is informed, the counter fraud specialist and the local pharmacist, and they will advise you what to do. If they're not found, or if they've been requested by your prescribing lead or your manager, and you filled out the documentation if you are in community practice, and they don't arrive, the NHBSA has to be notified as well. So, for those particularly working in the community, getting your prescriptions, it's not something that happens automatically when you qualify. You have to register with your professional body. Some of you may have to pay additional fee to have that qualification annotated on the register. For some you may not. Until your qualification appears on your part of the register, you can't prescribe legally. You have to wait until that happens. So you can check that first. Make sure that the annotation is for independent prescribing, V300, and isn't the old V100, particularly if you've previously been a V100 prescriber. Make sure that the new capacity is clearly on there. For those of you undertaking prescribing course, the university normally informs the NMC when you've been successful. They then write to you, or there may be a different procedure for those for the HPC or the Royal Pharmaceutical Society of Great Britain. Employers can check the professional register to see that you are actually able to prescribe in that capacity, and if you're not waiting for a prescription pad like you would be in the community, so sometimes the process can be quicker, for example in a hospital situation or prison situation where you're going to write on a drug chart, you still must make sure your qualifications annotated and your employer needs to check. You need to check what the local arrangement is, because different places have a variation of systems or forms or procedures that have to take place before you're eligible to actually get off and prescribe. So make sure you know what that is. Make sure that your contract covers you to prescribe. It may need to be amended if it doesn't do so. So that therefore you're supported by your employer for vicarious liability to be a prescriber. For those of you in the community, you will have to fill out a form with either your manager or prescribing lead, produce a specimen signature, and that goes off to Astron, which are the people that make the prescription pads, the FP10s. For those of you that aren't doctors, your pad will be a lilac colour. So although it's still an FP10, it's a different colour, which alerts the pharmacist straight away that it's not a doctor prescribing, it's a nurse or allied health professional. Your record of signatures kept then, and it's cross-checked each time you by the NHSBSA, where all prescriptions eventually find their way back to and data's collated and they can check if necessary that it is you signing the prescriptions and that you are on the database, etc. So you'll need to find out, as I said, what the local arrangements. So the action for employers, first port of call if you're in a PCT is ask the prescribing lead, but it may be your manager's experienced enough, having had other prescribers through, to know what to do. Those working in a hospital environment, again, you need to find out local procedures, I've already said, but normally the NHS BSA doesn't have to be notified as they do for the community. If you're working in a capacity where you work both using FP10s and hospital prescriptions, if you're in some sort of outreach or role where you do go into community running clinics and go back to hospitals, you may need to complete both sides. So you'll need an FP10, so you need to find out for you what you have to do. You may be the first prescriber in your area of speciality, so it may be you need to ask people from other specialities what they do, because you may be the first one to come through and no one's actually set a precedent before. This next slide talks about stock items, and this is saying that if drugs are prescribed, drugs shouldn't be prescribed from stock items. This is usually the case in the community because they've already been accounted for and paid for once. If you write a prescription, it's a double cost of the health service. There are a few drugs with an exception, and you need to check what was the old red book for general practice, but there is a list held within general practice of certain drugs where you can write a prescription against those stock items. You just need to be very, very careful, and you need to annotate the prescription in a certain way, but you'd need to check how you do that in terms of indicating that you are prescribing a drug that's from a stock item. Just to recap on security prescriptions, make sure you're complying with what your particular organisation says should happen for prescriptions if you're using FP10s, where they should be stored, how you get more, etc. And it's always good practice to hold a minimal stock. Just take care that you don't run out on mid-rounds in the day, but certainly don't go overboard and have lots of pads. You know, only take an amount of prescriptions with you. Tear some off a pad, for example. The serial numbers, as we've said before, it's good practice to record those in the patient record. If you still have a hard copy diary, it might be you want to use your diary for that. But check with your local PCT, because different PCTs have got different procedures in place. And as I've said before, never sign a blank prescription. If you lose a prescription pad, Astron are contacted. They're the people that supply the prescriptions, and the NHS BSA are notified only if that pad is never found. And counter fraud specialist and prescribing lead are notified, and manager.